Yeah, no, Dr. Alissa Sherry. She has had, because I've heard about Dr. Alissa Sherry for several years.
Okay.
I know that I've read some of the complaints. I've seen some of the complaints of other people. So your complaint was not something brand new to me. I was very familiar with the fact that there were lots of complaints about her, but she seemed to have hobnobbed her way into the family court, the family destruction industry somehow, that she became a favorite of certain people. At least it would seem that way. But I've not really heard of anybody who thought that she did a good job, a decent job. And the other thing that I've noticed when I used to follow some of her tweets and stuff like that, or some of her postings, she seemed to be a damaged person herself. And damaged people. We say that, hurt people. She just seemed to me like she had a lot of issues herself. I don't know if you want to go into that at all, but again, with Dr. Alissa Sherry, doctor whatever, she just seemed to cause more destruction and pain and financial hardship and almost abuse of one of the parents. That I'm just so surprised that her license has not been revoked, or at least her credentials questioned, or her practice questioned.
Well, I think that I have to be very careful. I can say factually that she's posted blogs that have indicated different aspects of her life that could, with anybody else, create an adversity later on in life.
Well, let me say, if you took one of her posts and she saw it and she was using it in a child custody evaluation, it would be negative against that person, wouldn't it?
Wait, can you rephrase that? I didn't understand that.
Yeah, what I meant to say, and I hope I didn't distract you too much here, but some of the tweets that she has used, if another person were to use those tweets, and if she were to evaluate those tweets in a child custody evaluation, or another person do so, I think that some of those tweets would be used to question the fitness of the parent, or maybe look at the parent in a negative manner.
I see what you mean now. Yeah. If a parent had published similar tweets,
right,
then that could be used against that parent in a damaging manner. Yeah, I would agree with that statement. I think the other thing that we need to emphasize here is this is a public service message.
Yeah.
This is a public service message to protect the public.
Right.
And to be very aware and to research that if ever you want any kind of mental health professional to be involved in any kind of child custody case, or to many mental health professional be involved in the care of your children, the care of the family, do your research carefully.
Right.
Okay? Because you don't want to end up, after the fact, finding out information and then realizing, okay, what happened wasn't fairly adverse. It was unjustly adverse, and it's damaging.
Right.
I mean, if we go from the standpoint in family courts, where the number one issue is to protect the children, protect the relationship of the child and the parent, to protect the parents, and start from that point, and whatever we do, we preserve that relationship.
Right.
We preserve the integrity of that relationship because there are less restrictive interventions that can occur.
Right.
Then I think the damage to our kids will start being much less. The damage to our parents will start being much less because you can go to any blog on the internet, you can go to any Facebook page, and you're going to hear just stories and stories and stories about evidence being ignored, testimony being twisted around, facts being twisted around, the separation of children and parents in such an unjust fashion. It's like we're living on Mars.
Right.
Actually.
Right. Right.